Yes, Dr. Ritesh.
Thank you, Dr. Gupta. So this particular video which I am going to be showing is using two of our innovations here. This was a case which was being planned for DSAEK, and our cornea surgeon, the first difficulty they were encountering was to really understand the anterior segment, how the iris is, how the pupil is, how the lens is. So we put in a chandelier illumination as we showed in for our cataract surgery. That chandelier when bypasses the corneal opacity, and it beautifully showed our cornea surgeon what kind of an anterior chamber were they dealing with. So it bypassed, gave us a good red glow, showed where the pupil is, where the PIs are, so that they could plan their surgery accordingly. Subsequently, the steps of DSAEK were carried on as planned. The descent was stripped off, the lenticule was prepared. So this is being lenticule which has been put in the glide and positioned and through the scleral tunnel with the hand on the opposite side at 6 o'clock. The lenticule is put into the anterior chamber. This was a failed graft patient. So the descent was removed and this new descent lenticule was put in place. Now, post this, what Dr. Gupta was talking about is generally needed. Again, the position was checked under retroillumination from the chandelier. And now we put in the 30 gauge needle attached to our continuous air infusion from the vitrectomy machine. Now this fills in the anterior chamber. The pressure is set at 60. The cornea surgeon can then gently glide the lenticule into its centered position, keep it well centered on the eye. So slowly there you can see them manipulating the lenticule, keeping it in the center. The air fills up the anterior chamber, maintains it nicely full at 60 for 10 minutes. After that, to decompress, you reduce the pressure on the machine to 20. The eye maintains the pressure. You're just checking the pressure here and subsequently just close the wound. Keep the infusion in place there. Don't allow the air to escape completely. Keep it at a lower pressure after 10 minutes. It keeps the lenticule in position. Your chances of next day having detachment of the graft is practically taken down. So that's a small trick from another small trick from our VR surgeon, which we kind of helped our anterior segment surgeons to use from our machine. Thank you.
And thank you, Ritesh. Any questions from the audience about the last and the second last talk? Any comments, ma'am? With this...
Thank you very much. With this, we come to the end of our instruction course. Thank you all for coming. I hope we had shared a few good points for you to take back with you today.